Ohio's Attorney General has ordered abortion facilities to halt services as a way to conserve medical resources as the coronavirus pandemic continues to spread. And in Texas, Governor Greg Abbott issued a statewide order to ban non-essential surgeries, which a spokesperson confirms does include abortion in most cases. But elsewhere in the nation, the abortion industry continues to be business as usual. In fact, there are pro-life groups that suspect abortion numbers may be rising as this coronavirus health crisis is coupled with surging jobless claims. In the face of this economic uncertainty, what will it mean for abortion rates and for women with unplanned pregnancies? To discuss this, we are joined via Skype by Lori Szala. Lori is the National Director of Client Services for Human Coalition, a pro-life care network. Lori, thanks for being here. Human Coalition serves and supports over 45 pro-life pregnancy care centers across the country. What are the nurses and counselors at your call centers hearing from pregnant women right now? Is there a trend they're noticing during this pandemic?
Yes, actually, the women facing unplanned pregnancies are already in a difficult situation, and the current crisis is only compounding that stress. Most of the women we are speaking with are hourly employees, and they are facing job loss and financial distress. So there's an urgency in their voice and in their messaging. They are fearful because they have lost their jobs, and the financial burden is so great that they are considering abortion as their only option. They feel hopeless and don't know where to look for the resources.
Lori, is there an example you can share with us of how pregnant women are being affected by the coronavirus pandemic?
Absolutely. The other day, we received a phone call from a woman who was a flight attendant, and she was losing her job during this time and was wanting to abort because she was going to be out of work and in financial distress. Said she didn't believe in abortion, but here she was considering it because of this situation.
Lori, it is a very uncertain time for our nation right now, for our world right now, including economically. Some experts suspect we're entering into a recession or even possibly a depression. What should the pro-life movement know about how this will impact women in unplanned pregnancies?
That we need your prayer now more than ever. These women who are calling and who are struggling need resources. They need our support, and they need to know that there are people out there who are willing to help and walk alongside of them.
And finally, Lori, if there is a viewer who is watching right now who has an unplanned pregnancy and she's scared about her future and her baby's future, what do you want to tell her?
You are not alone. There are people here to support you. There are resources to help you through this pregnancy and during this time. This time is going to pass very soon, but we are going to stay beside you, walk with you throughout your entire pregnancy, and help you in any way we can. Just give us a call. We'll be here.
Lori Szala, National Director of Client Services for Human Coalition, thank you for being a light and a hope right now.
Thank you.
To continue this conversation, we now speak with Dr. Tara Sander-Lee. She is a senior fellow and director of life sciences at the Charlotte Lozier Institute. She joins us via Skype. Dr. Sander-Lee, abortion is never necessary to save the life of a mother. So how is it that any abortion centers are staying open right now during this pandemic? These are non-essential services.
No, you're exactly right, and it's a fantastic question. And this is really just another example of how the abortion industry is truly never interested in the preborn and inpatient health, but they are really only directly focused on the intentional destruction of innocent life. Abortion, as you know, is not health care, and it is definitely not an essential procedure. And so there are even abortion clinics that are defying state orders and staying open. By them continuing to do so, their continued operation just further depletes the sorely needed resources that we need right now to help patients in real need with coronavirus. And we know that abortions can lead to complications, and then that will just further overwhelm the already overextended emergency rooms. So the abortion industry is just compounding one crisis with another by continuing to stay open, and it is wrong.
What does this reveal to us about the great need for our pro-life pregnancy care centers right now?
It is so important that pregnancy care centers stay involved, and that pregnant women really understand that they are an excellent resource right now to get some very important information that we actually want to share with you right now. Mm-hmm. So the good news is, based on our extensive research analysis of current data coming out of China, for women that are pregnant and have COVID-19, that there are really 5 facts that I want to share with you. That 1, pregnant women do not appear to be at a higher risk of infection compared to the average healthy adult. As you know, many of the people that are at highest risk are greater than 65 years of age and also have some underlying illness issues such as diabetes or lung disease. And what's important, too, is that there's no evidence of vertical transmission of the coronavirus, which means transfer from the mother to the baby during pregnancy. And this is unlike other viral infections, such as Zika or the Ebola virus. And so what this means is that if a mother does have COVID-19, when she delivers her baby or has her baby, the very unlikely chance that she will have given that to her baby. It's also important to note that there have been no cases of maternal deaths to date in pregnancy for women that have COVID-19. There's also women that are infected with the coronavirus during pregnancy actually go on to deliver live babies. And also, there have been no deaths from coronavirus in neonates to date. It's important to note that some of these babies that are born appear to be healthy. Others are having some perinatal complications, such as shortness of breath. Breath. But what's important to note is that these babies that are being born are not testing positive for the coronavirus. So any perinatal complications, and there's actually even one case that the infant died 9 days after birth, that there's no evidence that it was directly associated to the infection from the mother. And so we really encourage mothers that are pregnant right now and either are concerned of getting the coronavirus or have the coronavirus to keep their babies and to really seek out these pregnancy care centers that can provide some really important support during this uncertain time.
That is absolutely important information we want to get out there. I also want to get your reaction to something else. There was an article in the Washington Post last week which claimed President Trump's ban on aborted fetal tissue research is blocking a coronavirus treatment effort. The article states, quote, "The inability to pursue these experiments on the coronavirus is the latest example of disruptions to scientists' work caused by the administration's restrictions on research involving fetal tissue." Can you respond to this? Is this true?
I can respond to it, and I can tell you very emphatically that it is not true, that this article was really playing on the fears of the American people right now during the coronavirus crisis. This story was blatantly misleading and exaggerated. So the fact is that no lives are going to be lost because these few scientists cannot obtain and use tissue from aborted babies. And so these scientists, I just want to back up and explain a little bit what was going on. The scientists wanted to exploit the current coronavirus situation in order to receive an exemption from the HHS rule made back in 2019, which banned them from using federal taxpayer dollars in order to conduct their research using tissue from aborted babies. They now wanted to be able to obtain some what are called humanized mice that have a human-like immune system from another laboratory. And these mice specifically had they had tissues they had the livers, the thymus, and the lungs from aborted babies in them. And so they wanted to use these mice to test potential therapies. They weren't even going to develop new ones. And what's also important is that these mice that they wanted to use, these mice had only been published in one time, and there was no evidence to support that these mice could be infected with a specific strain that is affecting, right now, the pandemic, the COVID, the one that's causing COVID-19. So we don't even know if the studies that they were proposing would in fact work, let alone be able to be used to screen for potential therapies. So we really encourage scientists right now that are stating that they need these tissues, that they don't, and that they should focus on the many numerous alternatives that are out there, including humanized mice that can be made with ethical alternatives such as cord blood and tissues from other surgeries that are normally discarded. And in fact, for the coronavirus, right now there are over 60 potential treatments that are in development that do not rely on body parts from ongoing abortion. So
that's such important information. We are so grateful for your expertise and insight. Thank you so much, Dr. Tara Sanderlee of the Charlotte Lozier Institute.
Thank you.